Okay, I think people are still getting back from the coffee break, but we're going to start our session. We're running a little late, but it's okay because we'll have time to get back on schedule with our lunch break. So it's my honor and pleasure to introduce Judy Bowen, who is our keynote talk for today. We are very happy that you accepted our invitation and was able to come to Brazil and to IHC and Interact to give this talk. So Judy is an associate professor in software engineering and computer science. Originally from South Wales, Judy moved to New Zealand in 1999 and completed her master's and PhD in Waikato University. She started as a lecturer at the university in 2011, and since 2019 has acted as an associate dean academic for the Division of Health, Engineering, Computer, and Science. Her research spans the disciplines of software engineering, model-driven development, and human-computer interaction. Recently, this has focused on research into ubiquitous technologies such as IoT and the digitization of social practices, such as finance. She was a PI on the MBIE, Smart Ideas project on this topic, which investigated the use of wearable technology to support workers in hazardous work environments. And she continues to supervise students and a postdoctoral fellow on this work. So with no further ado, Judy.
Thank you. Thanks for the introduction, Raquel. And thank you, Raquel and Andre, for inviting me. I'm really delighted to be here. Firstly, it's always great to be at Interact. I'm always happy to get the opportunity to be here. It's my first time in South America, so that's also very exciting. So I'm just really happy to have this opportunity to talk to you today. I have 3 goals for this talk. So the first one is hopefully to make you think differently about some things that you might know a lot about already. The second one is not to fall off the stage. And the third one, because I have a hand microphone, is not to wave my arms around too much and throw the microphone at anybody. So hopefully I can achieve all of those 3 things and get us back on track. So as Raquel said in the introduction, I'm from the University of Waikato. And that is in New Zealand. It's in the North Island of New Zealand, a place called Hamilton. So if you know Auckland in New Zealand, we're kind of an hour and a half south of Auckland. This is part of our campus. We have a stunning campus. We probably have the nicest looking campus of the 7 New Zealand universities. And if you haven't been to New Zealand and you want an excuse to come, then please talk to me at some point this week and I will extend an invitation to you. You do have to pay your own airfare, though, I'm sorry. But I would be delighted to see you. So the talk itself also has 3 parts. So I'm going to start just by talking a little bit about the human-centered computing that I do. And really that stems from the work I've done in the past. So some people will kind of know me as a formal methods person and a formal methods and HCI person. So I'm going to talk a little bit about that first. And that's going to sort of lead into how I got into IoT and wearable computing, and then into the third part of the talk, which is mostly about the emerging challenges that myself and my fellow researchers have been seeing in this area that have led us to start thinking more about what it means to keep humans in the loop. Where in the loop should the humans be, and where actually is the place of human-centered computing, and how do we make sure that it stays central in the domain of kind of smart systems and the Internet of Things. To remember to point this in the right direction as well. So where did this start? So my original research was in the intersection of formal methods and HCI. So I'm one of those people who's a firm believer that both formal methods and HCI have fundamentally the same intent. And that is to make sure we build systems that work and we build systems that people can use. So the system should be robust and reliable, but they also should be usable by people so that they can do the right thing. So when I first started this area of research, that meant I was looking at model-driven development, so formal models for interfaces, for interactions, for interaction design, and also including things like testing, but the kind of the core of it really was to make sure that when we were dealing with systems, we treated both the users, the interface, and the interaction with the same level of rigor as we do perhaps other parts of the system, particularly when we're dealing with safety-critical systems or in areas where kind of errors are going to cause major problems. So I was working in that area for a number of years, and for a long time, that meant I was looking at these kinds of devices. So from kind of 2011, 2012 onwards, I was doing a lot of work with small medical devices. And in fact, there were a whole range of people around the world who were doing kind of the same thing around the same time. So I think Harold Thimbleby and the Chi-Med group in Swansea were working with these devices at that time. People like Michael Harrison, Jose Campos. We were all kind of looking at these infusion devices and syringe drivers because there's lots of very interesting properties about these devices. So firstly, they look very simple. They typically have small numbers of buttons and small screens, and they're designed to deliver medication to patients. But actually, it turns out that there are an enormous number of faults or problems or errors or incidents. I love that word, incidents. It kind of hides a whole realm of different problems. But there were things happening with these devices, and we were really kind of keen to understand why. So if they are very simple, why is it that they're problematic? And the particular area in which they were problematic was around their use. So of all of the kind of errors that people like the FDA in the US were recording, about 90% of those were being recorded as user errors. So then the question is, why are small, simple devices that are used by people who are highly trained, doctors, medical personnel, people in clinical settings, why are they unable to use these devices? And so we spent a kind of number of years investigating and looking into these. And of course, one of the main problems is that the simplicity of the interface hides a whole other world. So if you were to say, for example, what does the red button on that device on the right do? Well, the answer is, it depends, because they're modal devices. So depending on what mode the device is in will depend on what that button does. And if you start mapping out the model of all the different modes and all the different buttons and all the different behaviors, which of course is something we spent lots of time doing, you end up with something incredibly complex. And then you find out what the user's mental model of this device is, and it in no way matches that complexity. So that was giving us kind of some clear indications of why these kinds of devices were problematic to use and why there were this huge number of problems arising. And so this was very interesting, and we spent a long time looking at them, and every now and again we still come back to medical devices, not these ones in particular, but similar ones. But one of the things that started to become, for me, kind of frustrating in this work was the ability to have real impact. Because we don't build these in New Zealand. We import them from overseas. And even the people who are importing them into the country really didn't want to engage with us around how good or bad we thought the devices were and what we thought the problems were and how they might fix them. So while it was very interesting, we were finding lots of great things, I always felt that we could only push that work to a certain point. And we reached a stage where it's like, actually, I want to do something that has some real-world impact. So I did what most of us do. We start talking to other research groups around the university and around the communities in which we kind of work and live. And because I'm based in New Zealand, we, of course, have our indigenous population. We have the Māori population of New Zealand, and we also have a large Pacific community in New Zealand. So we have very specific groups of people who we work with and alongside, and we have obligations to working with those communities as well. And so we were having a meeting with one of the research groups, the Māori research group at our university, and kind of talking about this problem and talking about, where where are kind of the real world impacts? And again, we were still sort of focused on medical devices and medical settings because our indigenous population, our Maori communities and our Pacific communities have really poor health outcomes as opposed to other parts of the population in New Zealand. So we were still sort of focusing in that area. And at some point, the director of the research group sort of stopped us and said, look, if you want to make any real impact right now in a societal problem in New Zealand, you need to be looking at forestry. So that was not what we were expecting. I thought, well, forestry, I don't know. Firstly, I know nothing about forestry. And secondly, what on earth has computer science and software engineering got to offer forestry? And what are the problems that are being kind of referred to? So the problems, it turns out, are that in New Zealand, we have a lot of forestry. We also, at that point, 2013, we had per capita the highest accident and death rate in forestry of any country in the world, which for a small country is a scary statistic. So the first thing you ask is, well, how is that even possible? And one of the contributors to that is really the terrain of New Zealand. So we're a mountainous country. We plant our forests on mountains. So if you look at a country like Canada, who clearly has way more forestry than we do, it's a very mechanized industry. So they use lots of machinery, and they do lots of their harvesting, and the real dangerous jobs of cutting down trees, moving them around is done by machines. And those machines can't be used in New Zealand because we're on the side of a forest, side of a mountain mostly in these forests. So part of the problem was the sheer number of people we have working on the ground in forestry compared to other countries. So that was kind of the first thing that we found out. And then the second was there was a general belief that fatigue and tiredness was a huge contributor to the accident rate. It was meaning that people's reactions were slower or that they weren't paying enough attention, and that was contributing to our poor statistics. So that was something that we thought we can get involved with and we can look at. So this is where we start kind of moving into the Internet of Things through wearable technology. So again, if you can kind of cast your mind back to 2013, the thing that was really taking off, here's our forestry guys. The thing that was really taking off around that time was these wearable trackers. So we'd moved from 2012, 2013, we'd moved from the pedometer to the digital pedometer, moving into the wrist-worn age of trackers. So the ones on the left there are the kinds of things we were looking at in 2013, the really early Fitbits, the Jawbones, there were hundreds of them. The market was absolutely flooded with wearable, starting with step counters and activity trackers, and then some of them including things like heart rate monitoring. Companies like Garmin, who had the chest straps and those kind of sports, were moving into the wrist-worn stuff as well. And the reason that was relevant in kind of the forestry environment was because as we talked to lots of different people to try and find out where they thought these problems were arising, alongside this story of fatigue was this it's kind of an urban myth that we kept hearing over and over again. And what we kept getting told was that because forestry is such a physically demanding job, the workers were doing the equivalent of running a marathon a day. So if they worked a 5-day week, they were effectively doing 5 marathons in a row. So after we'd heard that about the third time, it was like, well, this is a really interesting piece of information. Where's the data that backs this up? Who's done the study and has the evidence to show that? And it turns out that there was no evidence. This was just something that had kind of evolved over time as an idea when people thought about kind of the workload and the work rate, but there wasn't actually any data. So that, for us, was kind of a meeting of two things. It was like, well, there's now this proliferation of fairly cheap wearable technology. There's an area where we could actually do the data collection and find out, firstly, is this true? Is it the same as running a marathon a day for 5 days? And if it is, what does that even mean? So end of 2013, we armed ourselves literally with a whole multitude of the kind of trackers you see on the left-hand side. So on the right, you see the kind of things that we have available now, very different. It's kind of a comparison, very different from what we were looking at then due to the speed of technology. And we tested hundreds of these trackers, and we set out, we thought, right, what we're going to do is we're going to equip 100 forestry workers with some kind of wearable device that will track their work effort, either through step counting or climbing or heart rate. And if we do that over a period of 3 months, we will be the first people to collect this big data set, and that will be a major contribution. That's something that we can do. So nearly 12 years later, we still haven't done that. We were never able to collect that data. And all of the reasons why have helped inform the research that we do now. And I could kind of talk about the problems in this project for probably about 2 hours. That isn't the focus of this talk, and don't worry, I'm not going to talk for 2 hours about it. But if you want to kind of talk more about that project particularly, I'll be happy to do so kind of during the week. So when we did our initial studies and we started running into a whole range of different problems, and some of them were technical, which is not surprising, because in all honesty, the devices we were using were not designed to be used in a hazardous outdoor work environment. So even when we started using kind of sensors in addition to the kind of off-the-shelf technology, things either weren't waterproof, or they would catch on branches and break, or they would short out because of the humidity, or the battery life wasn't good enough to last even a whole day's work. So the sorts of problems you might expect, which led very quickly to us needing to actually start building our own hardware. So as we started building our own hardware, we thought, well, we may as well start collecting some more interesting data and thinking about really what can we do with it. And not so much what can we do with it that will be useful for us, but of course, finding out from the forestry workers what will be interesting to them. So we started kind of running participatory design and co-design workshops. That in and of itself is a challenging thing to do, because firstly, a lot of the forestry teams, obviously, they're not kind of around the university, they're in remote parts of the country. So it required travel. It required us asking the forestry workers to stop working for a day so that they could come and talk to us. They already thought we were a little bit strange, so this was another step. It's like you have to kind of give up a day's pay or sign it off as a day's training. So it required a lot of buy-in. And then the other problem, which we needed to address, it was an us problem, was that many of the forestry teams we were working with were Maori forestry teams. So within the research that we do, as non-Maori researchers, as in fact, I'm from South Wales, I'm not even a non-Maori New Zealander, I'm what's known as tauiwi, I'm a foreigner. We needed to engage with Maori research partners to come and run the participatory design sessions for us, because really we don't have the right to walk into those spaces and to kind of conduct research or ask people things by ourselves. So we had to really develop good partnerships. So on the right-hand side of the slide here, there's a woman, Erina Korahina, who did amazing work for us, and alongside her, just behind the WorkSafe kind of representative, who sort of acted as our, if you like, kind of gateway into that world, because he had the respect and the trust of the workers, and so when he introduced us, they would then trust that we would do the right thing. So we spent a lot of time talking to the workers and finding out that the answers to the questions that we wanted were not the things that they wanted to talk about. That all of the things that we were really worried about, particularly around data privacy and data sovereignty, were also not the things that the workers were worried about. They had a whole range of other concerns and problems. And so we started kind of unpacking what those were and trying to find out what the underlying causes of those were. And at the same time, of course, we're sort of looking at wearable technology and wearable systems, not just in work environments, but in a whole range of different environments, smart cities and smart homes, and really kind of immersing ourselves into that literature And then we started seeing a whole range of other things. And slowly over time, we kind of started building up this pattern of what we called the kind of the common issues, the things that were going to derail not just this project, but a whole range of other projects that people might want to do. And then the question was, well, how do we begin thinking about how to address those? So the first one, and the one that came most clearly out of the work with the forestry workers, was the suspicion of the technology. So the suspicion of the technology was not around the fact that it was going to collect data from them and that data may be leaked or anything like that. It was much more fundamental. It was more that they did not really trust that if we gave them something to wear to collect some data, that all it was doing was capturing perhaps their step count or their work rate or their heart rate. They really were convinced that it could do much more. They almost had like a magical belief of what it could do. I think they thought the technology was way better than it actually was. So as an example, we would, talking about what the kind of barriers would be to using this technology, and a theme that came up over and over again was around more about being spied on than about the data collection. It's kind of being spied on from a higher level. So one of the workers said, well, every day my wife gives me a packed lunch and I take my packed lunch to work and I never eat it. And at lunchtime, we get a break and I go down to the servo, which is like a petrol station, and I buy a pie. Is she going to know from my technology that I bought a pie? No, absolutely not. But then this theme kind of started coming back in different ways. So then somebody said, well, just hypothetically, suppose I happened to take a bit of a break mid-afternoon and go off and have a cigarette somewhere. Would my boss be able to tell? So there was a real fear about this technology as kind of some kind of surveillance. And by then, we were really focusing on kind of the safety aspect, and the focus was very much on providing information to the workers themselves. This wasn't a tool to give to their bosses so that their boss could say, well, you're not working hard enough, or you're tired and you need to go home and I'm not going to pay you. It was much more about building a kind of an ecosystem amongst the workers themselves. So we called it the buddy system, where they could look after each other. But even that was met with, a real kind of underlying, initially suspicion, and then a kind of ability to subvert things. So a lot of our kind of early studies kind of broke down for reasons which you can't prove that they were things being subverted, because you can't go into the forest with the workers. You give them the equipment and you let them go off for the day, and at the end of the day you collect it back. But all sorts of kind of strange things would happen to it along the way, and I'm not really certain that all of that was due to the technology. I think a lot of it was to do with kind of the suspicion from the workers themselves. So as we started kind of looking more into that, the other thing we started thinking about was, well, what is the long-term impact of this? If you're suspicious of this technology, or you don't feel comfortable with it, and you're asked to wear it every day, firstly, we thought perhaps people will get used to it and they'll learn to trust it over time. But secondly, we started thinking about, actually, what if that isn't the case? What if it has this kind of compound effect where you feel worse and worse over time because you're constantly in this surveilled state? And again, that made us start looking much more closely at things like smart homes, a hugely researched area, and the kinds of technology that people were thinking about putting in smart homes, the kind of the monitoring and the supervising and cameras and sensors, and as we moved kind of further towards today, the kind of AI algorithms that are determining what people are doing. And again, the question was, well, what is it like to be in your own home, which is meant to be your kind of private space, surrounded by all of this technology that you could easily perceive as being surveillance? How does that feel over time? What impact does that have on people's kind of quality of life? And that's a really hard thing to measure, because firstly, running very long-term studies, and I'm going to talk about this again a bit later, is a challenging thing to do, but particularly in those kinds of environments. The other problem, and the other reason running long-term studies is tricky, is the speed of technology change. So if you think back to that slide with the kind of those really early kind of step counters, wrist worn, and then the kinds of wearable technology that we have today, things like my smartwatch or, all kinds of things you can wear in different sports, including swimming, the kind of personalized medical solutions that people are wearing. The technology is evolving incredibly quickly. And this was one of the things we found even when we were sort of working with the forestry guys, was that as soon as we were building something and starting to test it, there were newer sensors, there were better sensors, there was equipment that could do more. And so we were constantly playing catch up to try and make sure we had the best possible solution. What we started then to see that this was having an effect on, obviously not just us, but on the wider research community. And what we started to see was that in order to keep up with this technology, what was happening were that people were finding this new technology and using that as kind of the starting point for their research. So rather than, here's a problem, we want to solve it, investigate the technology, it's like, here's a really good new piece of technology, what can we do with it? That meant that a lot of this work was missing the human factors, and it was missing the HCI. So what I'm going to talk about here is kind of what I call the wider research ecosystem. If you think that at the center of that are all of the people in this room, all of the people who know about HCI and who care about human-centered design and who care about human factors, we think of that as being kind of at the core of our kind of research nexus. And as you get further and further away from that and you start looking at the research coming out of firstly software engineering and then mechatronics engineering and then electronics engineering and then wider into health informatics, we were seeing that the kind of dilution of HCI and the complete lack of any understanding of HCI was more and more common in that literature. Worse, that literature was increasing at such a rate that if I sent a student off to do a literature review, they would find way more of that than they would of the kinds of literature that we would expect to see. So now we have these kind of potentially invasive systems, and they're rapidly proliferating along with this new technology, and they're being developed with very little core HCI. And this is part of this fragmentation of research that seems to be happening. And I think it's always been there. We've always known that, when you look at the software engineering literature compared to the HCI literature, and then again you look at the wider engineering literature, often you'll see that there are obviously different focuses. But again, the speed at which all of this is happening now, the growth of the literature and the growth of the research in those areas mean that there's this increased fragmentation. So I did a research project a couple of years ago with some engineers at my university, and they'd been working for about 3 years on sort of IoT ecosystems for farming. And when I started working with them, it was the first time anyone had asked the question of, well, how does this work for the farmers? And they were sort of a bit taken aback. It wasn't a question they'd really thought about. They'd been very interested in the hardware, then they'd been very interested in the algorithms, and then they'd been very interested in things like, how do you do data privacy through federated machine learning? But it never crossed their mind to kind of take a step back and ask about the users. And so I had a student doing some what I would call really low-level, basic HCI work in that project, doing things like scenarios and use cases and user stories and personas. And it was just kind of blowing the mind of these engineers who thought we were inventing something amazing. And I kept having to tell them, it's like, this is really basic thing. Honestly, this is not something new. But again, it was an example of this kind of fragmentation that had occurred where this research now, research in computing and technology is not just in the domain of people in computing. Everybody now, it's kind of much more egalitarian, which is great, but it means that there are many more people involved in this kind of research who have no knowledge of or no interest in human-centered computing or even in HCI. So when I talk about humans in the loop, we think about humans being in the loop of some kind of system, some kind of reasoning system, and we say, well, you want to keep humans in the loop so that they can have some input. Actually, when I talk about humans in the loop, I'm talking about humans at every part of the loop, even before we get to a system. So human-centered computing means we keep humans in the loop at every stage. And what we were finding was that actually humans were out of the loop at every possible stage. So rather than people working with systems to solve a problem, systems were acting on people for some perceived problem in many cases. And one of the many impacts of this was this kind of increased digital divide between people who felt that they had the ability to have some input into the kinds of systems, or people who felt that they couldn't. So people like our forestry workers, who were quite happily working away in the forest doing their job, and then suddenly some strange women from the university turn up, and we have a proposition about technology and solving a problem for them, but it wasn't something that they themselves had asked for. Their bosses were quite interested in it, mostly for different reasons. And from a societal point of view, you could argue that this was potentially going to be beneficial and a good thing, but they themselves felt quite kind of marginalized by this. So I'm going to talk about these some more because these sort of led into the four challenges. So this is really kind of the third part of the talk. So these four challenges, which we kind of distilled out of those things we were seeing from the previous slides, really kind of led us to start asking the question of how do we actually address these? And what is the solution to these fundamental problems that are increasing and growing? And in order to talk about these, I'm going to talk about a very particular use case. And it's a use case that I suspect everyone in this room will be familiar with. And it's a use case that I expect will be turning up in at least 2 or 3 talks during this week, because it's a very common one. And the reason I use it as a use case is precisely that, because we all understand it. And it's not because I think it's a bad use case, but it's a use case that has become, if you like, almost like a straw man for the types of research outside of the nexus, which isn't really that worried about human-centered computing, but is technology looking for a problem to solve. So this is where we think about humans in the loop. What does it really mean to not just to be in the loop, but to be in the center of this IoT ecosystem that you have no control over? So here's our use case, the use case that I'm sure we all know about. Smart homes, intelligent smart homes, migrating now into the ability to support people living in their own home who would otherwise perhaps have to be in some kind of residential care or some kind of hospital. So older adults, people with additional needs, people who have medical conditions. So this has become probably the most commonly seen use case in the literature for smart environments. And again, it's been growing and growing over time. So in and of itself, we can see that there are some really relevant, interesting, and important things within it. But also, if you think back a couple of slides ago to that circle of problems, all of those are seen very kind of vividly and very problematically within this kind of use case if we don't properly address the human factors associated with it. So the first one, again, is this notion of long-term impacts. So now you're living not just in a monitored environment, so your home has become this kind of smart-equipped place with sensors and algorithms. It's not only monitoring your behaviors, it's also kind of reporting back on whether you're doing certain things well or certain things seemingly not well. So let's take the medication example. So often within these, there's a notion that we can make sure that people are taking their medication so that they can stay well. So if we think of kind of that decision point of the good things and the bad things, so there's lots of positives about that because helping people remember to take their medication is a good thing. But suppose as an older adult living in one of these environments, I also know that some of my medications have some side effects. So one of my medications makes me quite sleepy in the afternoon, and it also doesn't interact very well with alcohol. And I've got a group of friends coming round tomorrow afternoon because we're having a bit of a party. I want to be awake, and I want to be able to drink a glass of wine. So I'm not going to take that medication for a couple of days. So now what's happening? Well, now what's happening is that's being recorded, and that's being reported back to somebody. And at some point, somebody is going to kind of start sending me notifications and sending me reminders. And actually, that's not a life I want to live. I would like to have the autonomy to choose. Perhaps to be able to turn that off would be the human-centered way of doing it, saying, well, perhaps I can just pause that for a moment. But in many of these kind of scenarios, we see nobody ever talks about that. They don't talk about how the human can interject and just kind of dial some of this monitoring down. And nobody thinks about what it's like to live in that environment every day for a long period of time. The other problem here is often these systems we see are what I call shop window systems. So there's really clear and good descriptions of the kind of the technology in the home and the algorithms being used to analyze it and the types of things that will generate alerts. And then I always ask the question, well, where is that alert going? Because these systems don't exist in a vacuum. They exist in a society that we all live in. And I don't know what it's like in other parts of the world, but in New Zealand, we have a real kind of crisis in the medical system. We don't have enough doctors and we don't have enough nurses, and there isn't really enough money to keep the health system up running as well as it should do. Everybody is already overworked. So my question is, if we now start collecting streams and streams of data and analyzing that data and reporting it to somebody to do something, who is that somebody? Who has that capacity? So I would argue that if you want to propose these systems, you have to propose them within an environment in which they can actually practically work. They have to be designed not just with the people who are going to live in them, but the people who are going to be at the back end of them, with the clinicians, with the medical system, to understand actually if this is going to be helpful. If suddenly 150,000 people are living in these smart environments, how do we practically manage all of the kind of the alerts and the questions and the things that are being raised from that? Again, this is related to the speed of technical innovation. If I want to run a long-term study, probably within 6 months, at least some, if not all of that hardware is being deprecated and it's being replaced. And so actually, it's really tricky to do that. What you need to do is kind of say, well, let's kind of freeze people in a time capsule. We'll give you this system, and you have to stay with this for a year or 2 years, and then we're going to measure and see what the impacts of it are. And then supposedly at the end of that, we find after 2 years that the impacts are in fact really bad. Then that's probably not a study we should be running anyway. So we need to find different ways of studying these effects by taking them out of context, but still having the richness of all of the kind of the properties that we need to understand. So what we end up with if we don't do that is not just humans in the loop or on the loop or under the loop, but humans out of the loop. So for all of the amazing things that technology does, and there are 2 reasons I'm in computing. One is because I love technology, and one is because I'm really interested in people. But those 2 things have to work together properly. So I don't want to be at the end of some computation that I haven't initiated. I want to not just be in the loop, I want to decide what the loop is and whether I want to be involved in that loop in the first place. Technology can solve the problems, but it shouldn't be the only solution to the problem. And if we don't fully integrate those things, so back to our smart home, we can use technology to monitor things like gait analysis or medication, or am I sleeping enough, or am I sleeping too much? But we should only be doing that if we're answering a problem that those particular people want solved, and not because it's the option that's kind of been given to them. And this ties in with probably the most important part of this, which comes down to the sort of preserving of our human values. So back with our ambient assisted living use case, there's sort of an assumption built into that. And one of the assumptions that's built into that is that as you get older and you perhaps need more care and assistance, or if you have some health condition, you have two choices. You have exactly two choices. And one choice is that you go into some kind of care environment, into a hospital, or into some kind of respite care, or you can immerse yourself in the smart home and the ambient assisted living, and that will look after you. But that's an incredibly Western view of the world. So even within New Zealand, our Māori communities and our Pacific communities don't live like that. Those aren't the options or the choices that they have. So they have intergenerational living. They don't expect their old people to just go off and look after themselves or have technology look after them. They're embedded within their families. And so as we propose these kinds of solutions, what we're doing is completely ignoring their lived experience. This is not the kind of technology that solves their problems. They certainly have problems in looking after their older people, but they're not the problems that a smart ambient home will solve for them. So again, we need to go right back to those communities and to look at real people's real lived experiences and find out what it is that we could do that could help them. And how do we build that in a way that's meaningful to them and actually preserves their culture and preserves the way they live. The other thing that very rarely gets mentioned is kind of the cost of kitting out one of these ambient assisted living smart homes, and who are the people who can afford it. Again, you know, with my focus on New Zealand, there's a very clear divide in kind of the model of how people can pay for or not pay for their care as they get older. And some people are in very good positions and they could potentially, you know, purchase an amazingly well kitted out smart home if that's what they wanted. But for many people, that would be something that just wouldn't even factor in as a possibility. So rather than thinking perhaps of the fix everything in every possible way solution, getting kind of caught up in the technology, maybe we need to, again, take a step back and look for simpler and smaller solutions that are not just meaningful to the people that they're intended for, but are actually affordable and usable by those communities and people as well. So keeping humans in the loop is not just about systems where humans have the ability to be in the loop. It's about keeping all humans, which means everybody in every part of our society, in every part of the loop, at every kind of decision point, starting from, should we even be doing this? Is this actually a problem that we want to solve? Or is this a problem that the people we're intended to be at the end of this system want to solve? Is it the case that if you ask the forestry workers what they think the solution to their problem is technology, or is it the case that what they think is the solution to their problem is working shorter hours and getting paid more? Is it the case that the solution to somebody getting older and needing more support is not to move into a smart home with lots of technology, it's perhaps to have more human carers available to come and help them? And that what technology can do is to work alongside that and support those things and support what people actually need, rather than trying to replace it carte blanche without really thinking about the longer term effects of that. So how do we solve those problems? How do you solve those problems? I mean, many of you, I'm particularly talking to kind of the students and the early career researchers in the room, these are your problems to solve, because the speed of technology is not going to get any slower anytime soon. You're going to be fighting against this through your entire research career. So when we think about HCI methods, and we know, you know, we have this foundation and core of really amazing methods, actually, what are the new methods that are going to solve some of these problems? And when we start thinking about the use of technology and IoT and AI and all of these really smart embedded systems, we also need to think about who are they really for and who are we leaving behind and how do we make sure that we don't leave those people behind, that we develop these solutions for everybody. And as much as possible, capturing that fragmentation in research and trying to pull things closer together, actually solving that problem of the kind of, well, the fragmentation, yeah. How do we really make sure that interdisciplinarity is the way to go? We can work in an interdisciplinary fashion, but that doesn't mean we're kind of capturing all of the corners. So, in the simplest possible way, I have a kind of one-person crusade about this. Like many of us, I get asked to review papers all the time. And it used to be the case that I would only review papers from places where I would publish. So it's like, okay, I understand the work, I can review it. And now I've gone completely in the opposite direction. I'm actually reviewing papers from medical journals and from other kinds of engineering disciplines because it gives me the opportunity to push back. When I read a paper and there's no hint of HCI or no even remote mention of a user other than sometimes old people, without even saying what that age range is or what that means or where they live or what the demographics of those older people are, then I have the opportunity to push back and say, you know what, you need to actually read some of this literature. Now, I'm kind of perfectly aware that this kind of one-woman approach is probably not going to solve the problem by itself, but I throw it back to you to say, if you get that opportunity, being able to go into those spaces that aren't our natural environments, that aren't, these conferences are amazing because it brings together people who care about the same things. But when we leave here, what we need to do is then spread out and start making sure we're wrapping other people up in the information that we have. Because you have that knowledge, which means you have the ability to spread it and make it an interdisciplinary core, not just the core of our nexus, but the core of all of these wider research areas as well. Okay, so I'm going to wrap up very shortly. I have to thank all the people I work with. None of the work I do is by myself, of course. My research colleagues, collaborators around the world, all of the amazing students I've worked with over the years, external stakeholders and partners, they have contributed enormously to this work. And I want to finish with whakatoki from New Zealand. So whakatoki is a Māori expression that captures some important essence. This also happens to be the motto of my university. He aha te mea nui o te ao. He tangata, he tangata, he tangata. What is the most important thing in the world? It is people, it is people, it is people. Thank you very much.
For the questions.
We can share.
Okay, see if you can figure out the interface. Thank you, Judy, very much for your talk. It was really inspiring and a lot of good reflection coming from the talk. We do have time for a few questions, so if you have a question, I'll have this volunteer take the mic so you can speak up. Questions?
Hi. Thanks for everything you just shared with us. Actually, I do not come from an academic background. I come from a tech company back in Colombia, working with financial services. And I work at the research department, and we aim to reach that point that you just presented, we aim to put the user, the human being, in the middle of every single decision. And we aim to gather data that supports what that person or those users actually need. But my question to you is, I understand that you were questioning if technical decisions were being placed before the human, right? And without keeping that human in the loop. But have you had experience when it's profit, what's being kept in the loop before humans? Because that's something that actually in the industry, I get the chance to see a lot. And how data is supposed to support the bias coming from the business owners, and how profit-based decisions are constantly being made. And human is not placed in the center at all. It's just their own decisions. So I would like to know if you've had experience with that kind of interactions, because it's really challenging situation that we have to face constantly in the research department. Because you kind of you become the person who gives the bad news, and also have to constantly negotiate what's in best interest for the company stakeholders and the users.
Thank you. Yeah, that's a great question. And it's much harder. I mean, it's hard enough in research, but when you're in industry, it is even more challenging. Actually, my background is in finance tech. That's what I was doing before I went into academia. Back in the days when I was in the UK, I was working software engineering in the finance area. So I know that those kinds of challenges are really difficult. And in fact, there was an article, I think it was last month, in the ACM Interactions magazine that pointed out that kind of the first thing that goes when budgets are cut are UX. It's seen as kind of an add-on. It's a nice to have. And we know that that's kind of a fallacy, that actually if you want your customers to stay engaged and to keep buying your product, you have to make sure you give them something that is working for them. And that, you know, but of course in some sectors you don't necessarily have that choice. You know, we often sort of reflect on the fact that the university I work at, all of the software we use is terrible. And every time they replace it with something else, and we think, great, they're replacing it, we get something worse. And it's because those decisions, of course, are not made around things like the human factors or the usability or the value of my time if I have to log into the same system at least once an hour with dual authentication. Actually, what they care about is the cost of the software and the license that they can have. So we're always facing those kind of challenges. And again, when I was researching informal methods, that was always the argument. It's like, well, who has time to spend money on formal methods? It's a luxury. But what you need to be able to show people is kind of the end result. If you ignore those human factors, what does it mean? It means your customers will leave you because they will find someone who does it better. They will find a solution that will keep them engaged and that they will then keep spending their money on. In niche markets, that can be really tricky. You know, it's a big commitment to say, you know, if I don't like my banking app, it's still a big upheaval for me to go and change banks. And so it's almost like we give permission to do things badly because we're sort of locked in or we're trapped into it. And that's exactly the example of, you know, it's the wrong humans in the loop. It's not that there aren't humans in the loop, but it's the humans with a very different motivation. So I don't have the answer other than hopefully, you know, trying to find ways of showing the value actually of that.
Okay. Hello. Hi. Sorry. Thanks a lot for this talk. It's very interesting for me. It's my first time here at this conference. So my question is a bit into this distinction between needs and wants. So at least the way I understand it is that needs are like really basic for your survival, and wants are preferences. And in your talk, I felt that sometimes they were intermixed. In the sense that we as humans, I would say, we have few basic needs that are really important for our survivals. And then technology also, in a sense, it can feed some of those, but it often goes into also the wants, like what we could not, that goes into making life easier. And I'm just interested to hear from you, how do you think about this distinction? And also you mentioned at the end that sometimes it's the wrong people who gets their wants fulfilled with this kind of technology. And I just wonder, but isn't it also human nature to never be happy, never be satisfied? And how do you see this dynamic?
Perhaps I'm a bit more optimistic about people, but I mean, I think in terms of basic needs, I think you're right. Most of our basic needs can be fulfilled without any technological intervention. But of course, our needs have kind of evolved into the environment we're in, and so the blurring of needs and wants, actually, I think it actually is a genuine one. There are people who probably firmly believe that a fundamental need is that they have their mobile phone and they have internet connectivity and that they can connect through social media. And I don't say that as a trivial thing. That's become a really important people of some people's lives. And they probably feel that fundamentally that's a need for them, even though from the outside we may say, well, that's just a want. So I think there is a kind of a blurring between those two things. And I guess the question is the who is doing the wanting? Is it the person who's trying to sell you something, or is it you wanting to actually solve a problem for yourself and you would like technology to help you with it? And so my perspective is that hopefully that's the latter that we're focusing on. It's like it's fine if people, if people have the ability and the interest in totally equipping their home with every possible sensor and AI technology and kind of living in that environment, I think that's great. So the kind of the techie, geeky part of me is really excited about that and the cool things that we can do. But I also think there are lots of people who may not either want or need that, and we need to keep that in mind and sort of be respectful of that when we're trying to roll out these decisions.
So I have a question on the suspicion of technology. First, thanks, Judy, for the great talk.
That sounds like Albrecht, but I don't know where he is.
So the suspicion of technology, and what I see is, I think, with the examples you had, we can still have suspicion of technology because I get a device, I get something else. I think now moving forward with a lot of AI just put into the phone, we may be not able to have as end user a suspicion of technology because we don't even know what it is. And I think that brings me to the question, so how much of an education about technology do we require in the general public to even have this? I think I really like that you had this at the top, suspicion of technology. I think, but I can only be suspicious of something I somehow understand. And I think what we see now more, the society is moving forward, they know what's good for me, and this will be put into the phone. And I think very often they make we put seatbelts in, people didn't like that, but it saved a lot of lives. But I think this question of who really has the right to make the decision, but what do we need that people can even object the decision once it's AI, once it's built in?
Yeah, thanks, Albrecht. That's a great question. I mean, I think the answer is we should always be suspicious of everything. And in fact, the seatbelt example is a good one because, again, that kind of ties in with people's wanting to have autonomy. I don't want to be told that I have to wear a seatbelt. Now my car doesn't give me a choice because if I don't put my seatbelt on, it starts to make a really annoying noise that gets louder and louder until I put my seatbelt on. What I can still do, however, I'm not saying I ever do this, is I can close the seatbelt and I can sit on it. Allegedly, this stops my car from making a noise, but I can do that because I can see it. I can see it and I'm in the loop, I can interact with it. If it's going on behind the scenes, particularly with AI, and it's invisible and I don't even know it's there, then that's exactly the kind of scenario that I'm really kind of want to push back against because I don't even know it's happening. And you're right, it's kind of, the infiltration on the mobile phone is daily. I had a new one today where I was messaging home. I was just kind of being a bit smug about the weather and finding out how cold it was in New Zealand. And And my WhatsApp came up and said, would you like me to summarize your previous messages? I thought, well, no, because I've read them, but I'm going to say yes, because I've never seen this before. So I said yes, and it gave me this really strange summary of this conversation I'd been having for the last few days. And I was like, I don't remember asking for this. I don't know who thought that I wanted this or that this was a good idea. But that's kind of the tech by stealth. You know, it's kind of the infiltration of everything. So the fact that we don't understand it and we can't see it makes it even more important to be suspicious. And I don't think you need to know how it works to be suspicious of it. I think you just need to know that you should be suspicious of it.
Any more questions?
Thank you, Judy, for the talk. It was really inspiring. Just a question. You focused on IoT, which is a technology which is well hidden. So that creates further difficulty for possible users. It's hard to create a proper or an adequate mental model of what this technology is about, which relates to the suspicion discussion you just had. So how do you rephrase methodologically this into the context of your discussion of humans in the loop, given all these aspects like fast-moving technology well hidden, which makes it, for all of us, difficult to create a mental model. And if we want to add to that the cultural dimension you very nicely put with the Maori people in New Zealand who have their own cultural system and beliefs, etc. I mean, is this really a solvable problem?
It would be awful if I said no, wouldn't it? No, and I'm leaving now. I think it's like anything. When you look at it, when you look at the big problem and all of the parts of it, it seems like it is an impossible problem. But you know, in the same way, you know, that lovely analogy of how you eat an elephant, which is one bite at a time. I think we need to kind of pick our battles and look at the kind of fundamental parts of that. I mean, the problems with IoT and the kind of the hidden nature of it and the mental model, I mean, again, that's another 2-hour talk, really. And the fact that none of it actually integrates properly together in the way that is often proposed is also interesting. But I think even if you don't, I don't like to say you don't need to have a good mental model, but I think ultimately you reach a point where you can't have a mental model of everything that's going on. But it's almost, I think you need kind of a meta-mental model, which is how do I control it? How do I know the impact particular parts of it are going to have on me? And how do I either turn those off or dial them down? So perhaps that's what we should be aiming for, is kind of that meta-level mental model. Because already, you know, even with explainable AI, actually people don't really know what these models are doing or why. So how on earth can we have a proper mental model of these systems? I actually don't think we can. But I think we can find a substitute for that that may be kind of equally satisfying for us. I hope so, anyway.
Okay, I'm sorry, I didn't tell the Brazilian people that if anyone wants to make a question in Portuguese, ask a question in Portuguese, the translators can translate it to her. So feel free to ask in Portuguese, since we have the official translators anyway. One last question. Okay. So I want to thank Judy again for a wonderful talk. It's very thought-provoking. Thank you. We also thank ACM and SIGCAI that sponsored partially Judy's travel here and to be here with us. So thank you for being in cooperation and having you here in the ACM Lecturers Program. And now we are end this session and we come back at 2, if you will. Thank you. Sorry, for the, You have to stay because you're also a keynote for the Brazilian IHC. We're having the closing for the Brazilian IHC 15 minutes. So for those who want to stay, well, we have the translation if you want the people to translate to you, but it's just a 15-minute closing session. So feel free to leave, and the Brazilian people do not leave, please. Yes, and we're taking a picture of everyone. So before you go, let's take a picture of everyone.
Okay, everybody, can we invite you to stay with us for more 10 minutes so we can take a picture together, Brazilian people and our foreign